a patient is sort of deemed cancer-free, they're finished their treatment, it can be an adjustment to transition back to normal life.
I would describe or define survivorship as how people live through cancer treatment and move beyond it.
Some people do expect everything to just go back to the way it was, and that can be kind of hard when it doesn't. You know, that's true for the patient and the family members, but it's totally normal to have that period of adjustment.
After treatment, a lot of times patients go through a transition where they get readjusted to life after this pretty potentially challenging situation, and I think it's an opportunity for people to kind of reflect on kind of what their experience was and then look forward to what, maybe changing some or rethinking some of their values and life goals.
Determining when you're a survivor is really individual, and nationally we sort of think of at the time of diagnosis, you're considered a survivor, but that doesn't always fit with everyone, and that's okay.
Some people don't want to see themselves as a survivor. They want to get through treatment and then move on and not really have that cancer experience define them. And then on the other end of the spectrum, I think a lot of survivors will go on and say, hey, I want to take this experience and give back.
For some people, once they go back to work, maybe that's when they feel like they're a survivor, because that's the point at which they feel normal. Once they can get back to exercising, maybe it's something physical that helps them, or once they start mentally feeling like themselves again, that's when they kind of consider themselves a survivor. There's things you can do to sort of help to get there. A lot of times it's just the time and being patient with yourself. Sometimes it's helpful to meet with a therapist, a counselor, to sort of work through some of those feelings, some of those fears or thoughts that you're having about transitioning. Going with a support group can be really helpful. And then, of course, getting something like a survivorship care plan in place can also be really helpful.
When patients are done with treatment, they're not sure what they need to do moving forward in terms of managing their health. So a survivorship care plan is a piece of paper that a patient gets that has a concise record of their cancer treatments that they received, and then has recommendations on what their follow-up plan should be. So the patient will come in and sit down with our nurse practitioner and go over the treatment that she received, as well as what the recommendations are in terms of the follow-up care, and looking at maybe some lifestyle changes that the patient could follow to improve their general health, as well as reduce their risk for recurrence.
The fear of recurrence, that's a big one for most of our patients. Will my cancer come back? When will it come back? And so sort of coping with that fear is a big part of the transition period. Having that care plan can really help patients to reduce their anxiety and to focus on ways to help themselves going forward.
Patients typically come in for that survivorship care plan anywhere from 6 weeks after they finish their last treatment up to a year after they're done.
For a lot of patients, once they're diagnosed, you're very closely linked with the healthcare team, your oncologists, the nurses that you're coming to see. And then once that's done, you can sort of feel a little like you're sort of out on your own. And that can be scary for a lot of patients, especially with something with cancer. So that care plan is really helpful to sort of provide you that plan, if you will, from your care team going forward, so you still feel like you're connected in a way.